Okay, sorry for that short break. I need to put all my devices in the right position, especially for our online people and those that will be getting the recorded class. Sorry about that. Now, continuing from our last class and still on anatomy and physiology. If we should check our notes and can remember what we discussed here last week about the introduction of anatomy and physiology. By now, we should be able to getting familiar to what anatomy is about and some things that is very blank to us before. Now we are getting to shine light on it in order to know that this is the right things that are applicable to a medical practitioners or in medical practice. Like I say something that if you are practicing anything, even if you are doing herbal medicine, you are selling herbs, you are producing herbs, if you don't have deep knowledge of anatomy, you are not in the right place. You are just a quack because this knowledge is very, very vital. It is very, very important for us. So from what we discussed here in our last class, can you please give me subheading alone on our last class here? Just the subheading. Who is there, please? Directional things, body plane, and what? And sections. Is that all? Okay. By now, we should know the directional terms in anatomy, aside use of English. So these directional terms is what we will begin to use in our class now. You've already understand what anterior, posterior, inferior, superior is. Lateral, no, check it well. Yes. Posterior can also be called what? Dorsal. Okay. Proximal. Very good. Proximal means what? Away. Proximal. Don't say proximal is away. Oh. Yes, closer to the point of attachment. And when I say inferior, you understand it. Very good. And I said we should read about cells, tissue, and organs. Okay. And that is not all anyway. It also includes systems too. In anatomy, it also includes system, but the system is what I said we will have the discussion here in the class because the system is much more complex than that cell, organs, and tissue that I said if you read about. If we are to discuss on system, we have more than 5 to 7 system in our body or in anatomy, which by the time we start one after the other, you will be able to understand it very well, especially by the time you have the knowledge of those one that I asked you to go and read. So by the time we are into those systems one after the other, we'll be able to catch up very well. Now today, before we go into system, before we go into the system itself, today I want us to have a discussion on something called body parts and region. body parts and region, body parts and region, body parts and region. So in anatomy, when we are discussing about body parts or region, there are a lot of anatomical terms that we use. And don't forget, I say anatomical terms, it's a universal language. It's a universal language that when you mention it here, go to Australia, go to Canada, go to Germany, go to Netherlands, anywhere you go, that same language remain the same. As long as you speak English, that language remains the same. You understand? So body parts and region is another way that we use in communicating with each other in medical practice. And please let me to note that one very well. So we do have different terms sometimes that mean the same in anatomy, but it's still anatomical terminology. You understand? Just like in our previous notes that I mentioned posterior. You know, posterior can also be addressed as dorsal. You understand? Both are anatomical terminology, either dorsal, either posterior. You understand? It is still meaning the same, but the two is anatomical terminology. There are some aspects again, there are some region again that if you want to mention, you you mention something that is not that commonly used. Some terms or some language that are not commonly used, we also use it in identifying some location or some region in our anatomy. Are we together? So, do you get that? We have, what do I call the subheading now? Body parts and region. So, what I'm trying to say is that when locating body parts or region in the body, we have names for them. And I said some of these do not have just a name, just a single name. Sometimes we use group name to call them. What do I mean by group name is that, you know, just like we have different languages in Nigeria now. So every of this language, we've grouped ourselves. You understand? We have grouped ourselves. When we say we have Yoruba, Hausa, and Igbo in Nigeria, do you know that under Yoruba, there are still other language? You understand? Under Yoruba, but we've grouped them under what? Under Yoruba. Thank you very much. And the other people in the eastern part of Nigeria too, we call them what? No. And in that east, it's the Igbos too, they have other language too. But people that are not closer to them, and according to the geopolitical zone, we've grouped them as Igbos. But they know themselves within themselves. How do they know themselves is that by the time individual is speaking, so their language. So some Igbos will say, ah, I do not understand this particular people very well, but be the south side, we will say they are the same. You understand? And those two that are there, they will say Yorubas, they are the same. It is only Yoruba that will know how they differentiate their self exactly. Their self. So in anatomy, we have a group name that we give to some specific part of the body. Just like I said, upper limbs the other time. I mentioned something upper limb. Upper limb is not just a single part of the body. exactly, comprise many parts. So when I said upper limb, it is under that upper limb we will still be picking some parts, yes, that belong to upper parts of the body. So that is what I'm trying to explain. And I said some of these medical terms, they do not just have a single name. Some of them we can call it this or that, but they still belong to medical terminology, not English words. Are we getting it? And I made mention of dorsal as an example, that when I say dorsal, it should mean that I'm talking to the back, or I mean posterior part of the body. Are we together now? So let's continue. Under this body parts and region, we can write a number of terms. A number of terms are used. A number of terms are used when referring to a number of terms are used when referring to different region, or parts of the body. Let's try as much as possible to understand the anatomy very well. It's going to help us a lot when you speak, when you are doing your consultation, because I mentioned something on the first day, that if anyone is coming to you, they see you as their doctor. If anyone is coming to you for treatment, automatically you are the doctor. Whatever you give, we are going to give the person. Immediately the person is coming to you, you are a doctor. And before you can prescribe, you need to invite the person that is sick. You need to get the person history, the case history of that particular condition. So there will be a interactive section. So the way you interact with the person also build confidence in that person's mind. The way you interact with the person will make the person know that you know what you are doing. But if your interaction with the person is poor, that person will not have that belief that you can handle their condition. Are we together? So, and what is this interaction we are talking about? If you are able to, yeah, exactly. If you are able, as you are talking to the person, you are putting in those terms one after the other. You understand? And most of these patients that are coming, they've gone here and there, and they are familiar with some terms. Now coming to you, you are just talking throughout. You do not put any medical terms, or you do not understand deep down the knowledge of the condition that is being presented to you. You understand? Just like some Christians now, when they go to church, a pastor is coming to preach, or a imam is coming to preach in the mosque without using their holy book. It's either they use Quran or they use Bible. So the person is trying to preach for like 1 hour and not even telling you that, check, quoting scripture, thank you, without quoting any scripture. You know, you will be like, the person is saying all the stories. Even if the person do not open it and read clearly, at least you should be able to quote it and offhand and say it. You understand? So that is what will make you have the strong belief or confidence in what. So you too, as a practitioner in this field, you are talking to somebody, you never chip in the medical terms for the person to be convinced enough that that you are communicating medically. You understand? So we need it. That's why I said we need to build this foundation very strong, very well as we proceed. Thank you. A number of terms are used when referring to different region or part of the body. When referring to different regions or part of the body. It's something out for you here. Oh, okay, we are. Okay, let's continue. Full stop. Let's continue. The upper limbs is divided into the arms and forearms. Into the arm and forearm. The upper limb is divided into the arm and forearm, comma, arm, A-R-M, and forearm. Forearm is spelled F-O-R-E. Then you add arm to it. Arm is A-R-M. Then forearm is F-O-R-E-A-R-M. That is forearm. Forearm. Then you continue with it. Wrist and hand. Wrist and hand. Should we continue? Okay, the arm extends from the shoulder to the elbow. The arm extends from the shoulder to the elbow. And the forearm extends from elbow to the wrist. From elbow to the wrist. From elbow to the wrist. Are we there? Now let's talk of the lower limb. Let's talk about the lower limb. We talk about the upper limb at first. And that upper limb, yes, limb, L-I-M-B. Talk about the upper limbs at first. And Mrs. Efika, are we together? Okay, okay. Let's talk about the lower limb. The upper limb is divided into the thigh, TH. Yes, the lower limb, thank you. It's divided into the thigh, leg, ankle, and foot. Whatever you can spell, let me know. Ankle into the thigh, the leg into the thigh, comma, leg, comma, ankle, and foot. Ankle and foot. This knowledge of I'm trying to explain now, sorry. This knowledge of anatomy will help you. By the time you are pointing the body parts, you'll be able to differentiate them. Just like in this part now, I said the lower limb is divided into thigh, what? Ankle, what? Foot, leg and foot. Do you know that before now, let me just say some of us or many of us, if you want to if you want to point at the whole leg from this hip joint to your foot, you call everything what? Leg. Do you understand me? You will call everything what? Leg. And just like I said that day that I'm trying to show you the anatomical position. When you are talking to someone on phone and the person is telling you my leg, what the picture you will have is the whole of the leg. Yes or no? Very good. But now that you will be able to name those parts, now that we can segment it, if you want to report a case to me now on phone, for example, as we are a medical practitioner together, you want to report a case over the phone to me, will you now telling me leg now? Very good. You have to be specific. But before now, you have been using leg for the whole, generally, for the whole of this length of. Exactly, thank you. So you using leg for the whole of the lower limb, or using my hand for the whole of the upper limb. Do you know now that it is wrong? Do you know now that it is wrong? Especially when you are talking to somebody on phone, reporting a case. Ma, please take it easy when dragging the chairs. So as a doctor now, you are calling the whole of this upper limb as my hand, calling the whole of the lower limb as my leg. Wrong or right? Totally wrong. Totally wrong. You can see that the knowledge of this anatomy is not a waste to we, the medical practitioner. You are getting it. I said we should try as much as possible to build the foundation very strong, because by the time we will be building on it, the foundation will not be shaking. Oh, abi? So, please promise me that the foundation will not shake. Ehen. So, because what we are going to build on it is more than one story, more than two stories, more than three stories. So, please, let's try as much as possible to build it very strong. That is why I'm not here to rush us. I'm not here to rush us. So, you calling the whole of upper limb before now, hand, calling the whole of the lower limb, leg, now you know that it is wrong. So let us be specific. If you are talking to any part in the lower limb, let's try as much as possible to be specific by calling their name. By doing what? By calling their name one after the other. So in our notes now, what does lower limb comprises of? And the foot. So that names that we mention now, we may not know exact place where they are, but as we proceed, we'll be able to pick them one after the other. And that of the upper limbs, that we talk about the arm is from the shoulder towards, no, thank you. The arm is from the shoulder to the elbow. Then the forearm from to the wrist. And we have what? No, the upper, that is part of the upper limb. So you should be able to know that, okay, it is my arm. You understand? It is my forearm. You understand? So at that forearm too, we have joints there that we mentioned, the shoulder joint and the elbow joint. By the time we get into our skeletal system, we're able to mention the bones that form the shoulder joint, and the bones that form the elbow joint, and the bones that form the wrist joint, and these our fingers. So in anatomy, it is not fingers. You understand? So we call it carpals. Yes, but when we get there, but I want us to be building that foundation very, very strong. So we said thigh, leg, ankle, and foot. Now let's go. Full stop. We continue. The thigh extends. The thigh now extends from the hip to the knee. The thighs extends from the hip from the hip to where? To the knee. To the knee, then continue to the ankle. To the knee, to the ankle. To the knee, to the ankle. Do you get it, man? To the knee, to the ankle. Note, full stop now. Note that, comma, note that contrary to the popular usage, contrary to the popular usage, the terms arm and leg, the term arm and leg, popular usage, contrary to the popular usage, the term, the term, the terms arm and leg. I'm trying to point out two of these parts out now. That's what I'm trying to. No, no, no. Leg. Yes. The term arm and leg refers to only a part of the refers to only a part of the limb of the limb. Yes, part of the limb. That is related to what I explained earlier. When you say leg, when you are trying to talk to someone and you mention leg, so it's just a part of the limb. Exactly. So when at first when you are using leg before, you are just mentioning a part. As a medical person now, when I'm talking to you over the phone and you are talking to me that my leg, his leg, her leg, what the picture that we have will be different from your own picture. So the picture of a medical term leg, that's what me I will have. But somebody who is a novice that does not have the knowledge of anatomy, the person mean the whole body. Yes, the person mean the whole of the lower limb. But me, I'm referring to a particular. That is what that note is telling us. Do you? Yes. And somebody shouting, my hand, my hand, my hand. The picture that we have is that particular part of the arm. You understand? But the person may mean the whole of the upper limb. So that is what that note is trying to explain to us. Now let's talk about the central region of the body, still under body parts and regions. Let's continue. After that limb, you put full stop, then another paragraph. The central region of the body. We have talked about the upper limb and lower limb. Now we want to talk about the central. The central region of the body consists consists yeah, the central region of the body consists of the head, neck, and trunk. Head, neck, and trunk. Trunk, trunk, yes. TRUNK, yes. Full stop. Let's go. The trunk now. Let's talk about it. The trunk can be divided into the thorax. The trunk can be divided into thorax. Thorax. Thorax means chest. Thorax means what? Chest. You can write it too. Thorax, just put that in brackets, means chest. The trunk can be divided into the thorax, comma, abdomen, abdomen, abdomen. Thorax and abdomen, abdomen, comma, and pelvis, pelvis. Yes, pelvis, pelvis. Do you get it, man? I mentioned something about abdomen now. Now, let's write. The abdomen is often subdivided. The abdomen is often subdivided. Often, often, mm, superficially, yes, into four quadrants. Is often subdivided into superficially four quadrants. This is quadrant. Superficially four quadrants. This is the quadrant. By two imaginary lines. By two imaginary lines. Two imaginary lines. What are these two imaginary lines? One is vertical and one is horizontal. One is vertical, one is horizontal. That intersect, that is these two lines intersect. The one is vertical, one is horizontal. That intersect. So this is intersection. That intersect. No, 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 no. You are talking. Are you talking to me, man? No, it is the two lines that intersect already. That's the points which they met. They are intersect at the navel. Intersect at the navel. They intersect at the navel. continue from here. I'm with you. Vertical. The one from top is, yeah, vertical. Mm. The one that is lying is horizontal. Should we quickly mention, and I wanted to use this place as an assignment before, but let's mention those organs quickly before we continue because of our time. Right upper quadrant, you can short it like this. Right upper Q. Right upper quadrant. Since you've written it in full, so so that are we together? Eh. Oyin, ṣó wà pẹ̀lú mi? Now let's go. The right upper quadrant, you find the organs that you will find there. Right upper, we have liver. I'm not going to talk about the functions of liver now. When we get to that place, we will talk about. I just want to mention those organs that are there. We have gallbladder. We have right kidney. We have parts of the spleen. We have part of the stomach. No, stomach. Part of the stomach. We have part of large and small intestine. I repeat, liver, gallbladder, right kidney, part of the stomach, and part of large and small intestine. Let's go to the left upper quadrant, LUQ. We have spleen. Spleen. How you spell this? Yes, we are talking about the left now. We talk about the right at first. Now we are talking about the left upper quadrant. Number one, we have spleen, we have left kidney, we have part of the stomach, and we have pancreas. The pancreas on the body. We have spleen, we have left kidney, we have part of the stomach, we have pancreas, and we have parts of the large and small intestine. Part of the large and small intestine. Left lower quadrant. Use your shorthand, please. Left lower quadrant. Use your shorthand because of time. We have appendix. Left lower quadrant. We have appendix. Right reproductive organs. Let's write in front of this right reproductive organ so that you can know what is there. Such as the right ovary and fallopian tube in female. You know, we have right ovary. Yeah, I mentioned something last time that some of things in us are in pairs. Can you remember? We have the one at the left, we have the one at the right. Now let's go. Okay, still under right lower quadrant, we have part of the large and small intestine. Left lower quadrant, LLQ. Mm-mm. Yes, we have done upper now. We have done upper. This is lower now. LLQ. Left reproductive organ. Part of the large and small intestine. Where I can find you. Right lower quadrant. Now the last one is left lower quadrant. Who else is lost that we can find you? Where are you? Can we continue? Left lower quadrant. Left lower quadrant. Left reproductive organ. Left reproductive organ. Then part of the large and small intestine. Parts. Are we all there? Let me go through it one more time. Right upper quadrant, we have the liver, gallbladder, right kidney, part of the stomach, part of the large and small intestine. Left upper quadrant, spleen, left kidney, part of the stomach, pancreas, part of the large and small intestine. Right lower quadrant, appendix, right reproductive organ, part of the large intestine. Left lower quadrant, left reproductive organ, part of the large intestine. Large and small, large and small, large and small intestine. Yes, lower left quadrant. Do we understand this? Hmm? Hmm? Yes, 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 yes. We still have this as in nine. It's also subdivided into 9 segments. No, 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 no. I'm just telling you that the quadrants also extend to 9. Now let's talk about the body cavity. Yes, body cavity. Body cavity. Can anyone remember any cavity maybe you've heard before you come across? Is it teeth? Is it teeth? Is it tooth? Mention something before your cavity now. Ma, you try anyway. You say teeth cavity, but it's not teeth cavity. We call it oral cavity. Cavity is true. Don't mix it up. When they are advertising all this paste, they usually mention something cavity. That cavity is an infection. You understand? So don't mix it up with this one we want to talk about now. So the cavity we want to talk about now is uh, just like a hole, a space. Mhm. Now let's talk about the cavity. The body cavity contains many cavities. The body subheading is body cavities, please. Then the note under it, the body contains many cavities. Should I spell the cavities? Some of these cavities, such as the nasal cavity, open to the outside of the body. Some of these cavities, such as nasal cavity, comma, open to the outside of the body, and some do not. Yes, cavity, comma, open to the outside of the body, open to the outside of the body, comma, and some do not, full stop, do not, full stop. Let's continue. The trunk, you remember that we made mention of trunk. The trunk contain the trunk contains three large cavities. Three large cavities that do not open, to the outside of the body. The trunk contains three larger cavities that do not open to the outside of the body. So let's mention these three large cavity now that do not open to the outside of the body. That is, the trunk itself has how many cavities? Three. Three cavities. Now let's mention the three cavities now. We have thoracic cavity. Thoracic. Thoracic cavity. That is one. We have the abdominal cavity and the pelvic cavity. Are we together? Are we together, please? Now, do you remember in our notes when we talk about the central? When we talk about the central, do you remember what we mentioned there? Mm-hmm. Mm-hmm. The what? Now, that trunk itself now, we are talking something about the trunk. We say the trunk can be divided into thorax, which is chest, abdomen, ears, and pelvis. So we are referring back to that central now, that there are three cavities embedded in, not, no, thorax. Yes. We said the thoracic cavity, the abdomen cavity. Do you get the three now? Hmm? Hold on, hold on. When we talk about the central that time, we mention of trunk. Yes or no? We mentioned about trunk. Now that trunk now, the trunk itself, we are now saying that trunk contain three cavity in it. Even when we are talking about the central the other time, we mentioned pelvic or not? We mentioned it. You check your notes very well, you see that we mentioned it. So what are these cavities that are in there? We said the thoracic cavity, the abdominal cavity, and the pelvic cavity. Now let's continue. Full stop there. Let's continue. The rib cage, the rib cage surround the thoracic cavity. Yes, the rib cage surround the thoracic cavity. And the muscular diaphragm, I will explain, just write it down. And the muscular diaphragm separate it from the abdominal cavity. Yes, yes, separate it from the abdominal cavity. When you look at this side of the body, the chest side, which cavity do we talk about now? Which of the type cavity do we talk about? Thoracic cavity. You may not understand this thoracic itself clearly now, but when we get to skeletal system, part of skeletal system, we get to understand it. We say something divided from the muscle, divided the thorax from check notes, between what the abdomen cavity. Now look at, this is our abdominal cavity. This is abdominal cavity. We are saying this is thoracic cavity. And here is our rib cage. This place is our rib. The rib comes from the back and comes to the mediastinum. We have a bone here called sternum. This is bone, bone in between the two breasts called sternum. That's right. So when we get to you understand it very, very well. So this muscle and this rib cage is what differentiates this our thoracic cavity from the stomach cavity. This is the thoracic cavity, this is stomach cavity, and this is pelvic cavity. The bone that we sit on is our pelvic cavity. Please don't forget. Then abdominal Let's talk about the abdominal now. Abdominal muscles under abdominal cavity now. Abdominal muscles primarily abdominal muscles primarily enclose the abdominal cavity. I've already explained it, which contains the stomach, primarily enclose the stomach, the abdominal. Abdominal muscle primarily enclose the abdominal cavity, which contains the stomach, comma, intestines, comma, liver, comma, spleen, just like all what we mentioned in our upper left, upper right, lower left, lower right. All those organs that we mentioned there, they are what we are referring to again in our abdominal cavity. Are we together? Please don't lose. I can see your impression. Listen to me. Listen to me. Everybody listen. Don't write. Listen. In thorax cavity, say we have three cavity there, which is thoracic cavity, abdominal cavity, pelvic cavity. I explained that of the thorax before, and I'm talking about the abdominal cavity now. I said in this abdominal cavity, all what we have there, I said it entails, it contains the stomach, and I'll say all organs that we mentioned, both here, and here, are what is inside the abdominal cavity. I say what we mentioned in our right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. You remember that we mentioned some organs there now. I say all those organs now, we are now trying to say all these places now, we call it what? Abdominal cavity. Have you found yourself now? Eh? Exactly. Yes, we can carry them and put there. Just know that all those things, they are there, and which include the stomach, intestine, liver, spleen, pancreas, kidney. You understand? So as many as you can write, just bring them in. So it will include both left and right kidney. You understand? Liver. And let's talk about the pelvic cavity. Pelvic cavity is where the urinary bladder, comma, part of the large intestine, part of the large intestine. Are we there? If you are there, yes. If you are not there, no. Are we there? I can't hear. Pelvic cavity is where the urinary bladder, part of the large intestine, part of the large intestine, and the internal reproductive organs, internal reproductive organs are housed. Are what? Are housed. Are we getting it clearly now? So you can see what we can find in abdominal cavity, and you can see what we can find in pelvic cavity. That will make you recall when I mentioned going for scan, for abdominal scan and pelvic. Now you can see what are in the pelvic cavity now. And if the scan is being carried out, so those picture that we have in our pelvic scan now, it is what the results of our pelvic scan to will give us the explanation about. Mr. Fika, are you with us? Understand? If I'm too fast, let me know. And if you are to do abdominal scan, now look at the picture of what we have in our upper upper right, upper left, lower right, lower left. You can see all the organs that are there. That is what, if you have any abdominal scan result, please push it to the platform today. Any, if you have any abdominal scan on your phone, please push it to the platform. If anybody is having it, push it to the platform today. Tonight, I will I will continue from there. Do we understand me? Ehen. So, if any of those things that we mentioned under the abdominal now is not in the test, we will all see. You understand? We will all see. Can you remember what we have in our abdominal? Is the what? Ehen. Urinary in abdominal, not pelvic. No, I'm still bringing us, I like us to sharp our brain back. So, do you still remember what we have in our abdominal now? Yeah, the stomach. Now, anybody who has gone for abdominal scan before, you may not show the name. Oh, if it is, you may not show the name on the test. You can crop the name out, but please push it. Let's see. Let us, as we are doing this, let's start because anatomy is something that is real. Don't let us imagine. Let's see the reality. So we are talking about what? Let's be realistic, Abby. So we will. I will be waiting. Don't tell me that nobody is having abdominal scan that can push to the platform. I want to see. So on the pelvic now, do we see what we have there? It is what we talk about the urinary bladder, part of the large intestine. The internal reproductive organ, there are many. So to save our time, internal reproductive organ. Just like we mentioned, ovary, fallopian tube, um all those. Then we mentioned about the urethra. We mentioned about the bladder too. Bladder that houses the urine. You understand? Are you with me? So that is areas that we will begin to get the pictures of those things. That's why I say when somebody is complaining something for you, as you are getting the person information, inside you, you are multitasking. You are already thinking of what may likely be wrong with this person. As you are talking to the person inside you, you are thinking again of where is affected. And a time it will get to a stage, by the time you are doing your consultation, you are still coming to that. By the time you are getting history, case history from your patient, you understand? You in as much that you are able to how will I put it? Just like somebody is complaining of a generalized symptoms now, but inside you, you've already know that the problem is associated to this particular part, this region. Thank you. You've already know when immediately the person is complaining, it's doing me like this, doing me like, doing me like this. Inside you, you know that the problem. That is why that there's a place we mention appendix there. Do you remember now? There's a place we mention appendix there. Now, if you don't have the knowledge of the region of appendix, appendix is not in both sides. Oh. Appendix is not in both sides. Go and check your notes. Yes, appendix is in one side. Somebody should find it out. I don't see it. Eh? Right lower quadrant. Now somebody is coming and the person is complaining, and the complaint is associated with that particular part. Too much, right lower quadrant. What will come to mind? Among other things that you picture, appendicitis. This can be appendicitis, especially you already know the stage or the age that this appendicitis are mostly common to, and that particular young boy or young lady is complaining of that particular part, and you already know the symptoms and you know the location of appendix. So among your diagnosis, appendix should be number one out of your 1 to 4 diagnosis that you want to diagnose it by yourself now before sending the person for confirmation. Appendix should be one of your diagnosis. But now tell me, if this thing is happening to the the left, the left lower quadrant, will you now say appendix again? You see that the person is a quack now. Something is affecting somebody in the right side, and you say, this thing could be appendix. Meanwhile, appendix is located. Even if the person wants to have the pain at the left side, the pain will not be as much as. So when you press the lower side of the abdomen of the person, right lower quadrant of the person, the pain will be more severe. So that will be part of your. That is why we say this foundation we need to is very important. So let's take it serious. It will be part of what we need to consider that this person is having maybe having appendix. So I'm not saying just appendix that cause that pain, but you know all things that are associated to that region. So you'll be consider one after the other. But by the time you know the symptoms, particularly for a particular condition, that will also be helping you more and more. The more you have the knowledge of the body, the more you'll be able to picture, the more you'll be able to prescribe, the more you'll be able to treat that condition effectively. So you know that somebody is suggesting appendix for the left, the person is wrong. The person is a quack. So then let us be quack. Let's misdiagnosis. Thank you. So that is what pelvic housed. Bladder, part of the large intestine, and internal reproductive organ are housed. Now let's continue. The abdominal and pelvic. Let's write the abdominal and pelvic cavity. The abdominal and pelvic cavity. The abdominal and pelvic cavity are not physically separated. They are not physically separated. Looking ourselves at ourselves now, you can't separate it physically. Sometimes, okay, physically separated, and sometimes are called the abdominopelvic cavity, and sometimes are called abdominopelvic cavity. Abdominopelvic cavity. Yes. Should I spell it? Instead of abdominal, just put O, it will be abdomen O, then you add pelvic. Mhm. Yes, abdominopelvic cavity. So sometimes too, that text is being prescribed together. Instead of you saying go and do abdominal scan or go and do pelvic scan, sometimes in order not to waste money and time, abdominopelvic scan, that is from the stomach to the pelvic region. And if you see in that illustration, the physically you can't separate it. The stomach starts from here, from this lower region of the breast. The, the stomach starts from here and ends to the pelvic. But looking at individual standing up, moving, you can't easily physically separate it as a result of our knowledge of anatomy. question? Do you have question? No. So now that I have answered your questions, in the absence of none, till next week, right? How was today's class? As usual. We are moved closer, abi? We are getting it gradually. Gradually, gradually. Exactly, exactly. Beyond the picture we have before. Miss Africa, what do you have to say? Exactly. That is fine. Do you know that that is one of the reasons why we are not going to do physiotherapy now? Because if you don't have that knowledge and you want to go to the advance, no. So when we get to the physio, these are the terms that we are learning now. That's what we'll be using in physiotherapy. What? Okay, 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 okay. Yes, yes. Mm. Trunk. Mm. Exactly. The scarcity. That's good. And you also be able to train others. You understand? You also be able to train others. And if somebody is saying something wrong, and you know the right thing, you'll be able to correct the person. You understand? We can't say we cannot seek. You understand? We can't say 100% we cannot force it. Fine. Now, if a relative is even calling you over the phone and say this and this is what is happening, okay, go and meet doctor. What the doctor told you? Okay, send me your test results. Let me see. Even you yourself, you can even tell them. We talk about what now? No, no, before the imaginary line. Okay, the abdomen is not. Before we talk about the abdomen, we talk about the trunk and what? The trunk can be divided before trunk and what? Trunk and what are we talking about? And leg. Trunk and that. The head, the neck, and the trunk. What leads to the head, the neck, and the trunk? Central region. Exactly, that's what I'm talking about. We are talking about the central region of the body. At first, we talk about the upper limb. Second, we talk about the lower limb. And we explain what lower limb comprises of, unlike people using one term to illustrate the whole of the lower limb, you understand? And people using just one thing to narrate the whole of the upper limb. Fine. Now we can differentiate both upper limb and lower limb and what they entail, rather than using just one single word, one name, one term to explain the whole of this part. Now we are talking about the central part of the body, which comprises of the head, the neck, the trunk. And under this trunk, we mentioned about abdomen, we mentioned thorax, fine, and we talk about the abdomen. So under this abdomen, there's something I want to explain. That's the one made me to draw this out. See, this is an intersection. We said this, our abdomen is divided into four quadrants with two different lines. One is vertical, one is horizontal. This is vertical, this is horizontal. Then the intersection of this line is at the region of what? Is at the region of the navel, our navel. This is it. This is the intersection. So within you yourself, you have to picture it by yourself. So this, the abdomen, we say subdivision of the abdomen. This is the subdivision of the abdomen. Now, this is the four quadrants that we have in abdomen. We have right upper quadrant, right upper quadrant, and we have left upper quadrant. This is right lower quadrant and left lower quadrant. Do you get it now? So within ourselves, we divide it. Thank God we have established the fact of the sagittal, our left and right, and front and back, then upper and lower. So this is it. The left, the right, the lower left, the lower left, the lower right. So there are some things that we need to understand very well about this thing. It is not the quadrant, it's not this quadrant that we meant by this picture. Even this stomach also subdivided into 9 quadrants, but we need to establish this 4 quadrants first before we go to the 9 quadrants of the stomach. And why this is very important to we the practitioner is because when some complaint or some symptoms come to our way, you will be able to know immediately. You picture the stomach. You picture the stomach. You are trying to complain something for me now, and you say that this side of my tummy, this side of my belly, this side of my stomach or my abdomen, I'm having this, I'm having this, I'm having that. So in my picture, for me to understand this 4 quadrants, immediately in my mind I will divide it into these 4. And already I know what organs belong to this place. I know what organs belong to this right, left. I know the organ that belongs to the right, upper left, or upper right, or lower left, lower right. I said something last class that the knowledge of anatomy will even help you. It is what will help you to prescribe the right test, not even medication, the right test for the person to do what? To carry out. Just imagine, as we have upper limb, lower limb, in our abdomen, people do go for abdominal scan. People do go for pelvic scan. Yes or no?
Yes.
Now, the problem of pelvic scan now, you are not telling your patient to go and do abdominal scan. are we going to get the best results? No. You can't get the best results. You understand? But for you to be able to know the positions of the organs, the positions of those organs with the complaint of the person is what will help you to prescribe the right test to do. So we are still going to the organs that belong to all this colon. The organs that belong to all this colon. Because those are the things that's going to help us. Do you get me? Yes. Do you get me? Yes. Now, let me chip in this. If a woman is having issue with reproductive system now, the reproductive organ, the most test that is appropriately to prescribe is pelvic scan. You understand? It is what? It is that of pelvic scan. But let's assume that the person wants to check the liver, the kidney, the stomach, maybe the person is having fibroid or not. You go for abdominal scan. Now, somebody who is having symptoms of fibroid, and you tell the person to do pelvic scan, it will not pick
the right result.
Yes.